What causes cervical cancer? Imagine a tiny virus that can have a big impact on health. That's human papillomavirus or HPV, which is the main cause of cervical cancer. HPV is a very common virus transmitted through sexual contact. Most people who get HPV clear the infection naturally, but sometimes the virus sticks around, especially high-risk types like 16, 18, 31, 33, and 45. When HPV infects the cells of the cervix, it can cause changes in those cells over time. If these changes are not caught early, they can develop into cancer. Several factors can increase the chance of getting HPV or developing cervical cancer. Starting sexual activity at a young age or having multiple sexual partners raises the risk of HPV infection. Other sexually transmitted infections like chlamydia, herpes, gonorrhea, syphilis, and HIV can also make it easier for HPV to infect the cervix or weaken the immune system's ability to fight the virus. A weakened immune system, whether from HIV or medications that suppress immunity, makes it harder for the body to clear HPV infections, increasing the chance of abnormal cell growth. Smoking is another risk factor. Tobacco use damages the immune system and makes it harder for the body to fight off HPV, leading to persistent infections. Pregnancy history also plays a role. Women with 3 or more full-term pregnancies or those who had their first full-term pregnancy before age 20 may have a slightly higher risk, possibly due to hormonal or immune changes during pregnancy. Long-term use of birth control pills, especially for 5 or more years, has been linked to a small increase in risk, but this risk decreases after stopping the pills. Exposure to certain drugs like diethylstilbestrol, a hormone used in the 1950s to prevent miscarriage, can also increase risk. Women whose mothers took this drug during pregnancy are more likely to develop a rare type of cervical cancer. Socioeconomic factors matter too. Limited access to health care and screening can delay detection of early changes in cervical cells, allowing the disease to develop further. Family history and genetics may also play a role, although they are less common factors. Cervical cancer develops when HPV causes cellular changes in the transformation zone of the cervix, where 2 types of cells meet. Over time, these changes can grow into cancer if not identified and treated early. The good news is that preventive measures like HPV vaccination, regular pap tests, and HPV testing can catch abnormal changes early or prevent infection altogether. Practicing safe sex, quitting smoking, and seeking timely medical care are important steps in reducing your risk. Always consult healthcare professionals for personalized advice, as individual risk factors can vary. This understanding is supported by trusted health organizations like the World Health Organization, Centers for Disease Control and Prevention, and the National Cancer Institute, emphasizing that HPV infection is the central cause of cervical cancer and that many risk factors can be managed or reduced with proper care.